Ladies and gentlemen, welcome to this very special episode of the Visionary Circle podcast. It's me and my lovely co-host, Mr. Sergio, and we are always striving to bring you experiences that are educational, that are valuable, that are good for your long-term health. To be a visionary, to be a creative, it is a holistic attempt. You have to make sure that everything in your life is in line so that you can perform at your best. And our guest today is in a category that we have not explored before, but also very essential to your overall health. Welcome, Dr. Tony.
Thank you very much. Glad to be here.
Thank you. Thank you for coming. This means a lot to us. Dr. Tony, can you tell us a little bit about what you do?
I help heal and restore the strength of your nervous system. Really, I'm a chiropractor, and a lot of people think chiropractic's about low back pain, neck pain, right? Headaches. I hurt my back. Go see the chiropractor. But really, it's about maintaining the life force of your body. Your spine and nervous system is the foundation of life and health in your body. And when you interfere with that, your body is not going to express life and health properly. And that's what we do. Just help restore your strength.
Amazing.
Before we go deeper into it, so I've been wanting to do this series of like the people that helped me get my life back. And when I describe you, I always tell people, Dr. Tony and his practice literally saved my life. And that's without joke. I say it to everybody. And I'm glad you're here. I always wanted a platform to be able to showcase who you guys are, the ones that helped me out. And then again, I'll say it again. I said it in Christy's podcast. I believe God gave me to get to know Leo, and Leo having this room, having this podcast, and then it clicked on me. I'm like, oh my God, this is now my chance to be able to showcase who are the people that helped me and hopefully can help somebody else that's out there. So I appreciate you coming here again. And I seriously cannot thank you enough for what you did for me and to some of my family members, but it literally saved my life, and thank you for that. Yeah. When it comes to chiropractic, I've done a lot of chiropractic. I've met a lot of chiropractors that have done just the adjustment stuff. And I think that's the reason why a lot of people think that that's all it is just adjusting the back. Oh, you have, some pain here. Here you go. So here's some temporary help. But when I met you through Christy, as you guys know from the previous episode. I was dealing with a hernia. And that's how she didn't even recommend me a chiropractor to help my spine or anything. She was just like, I know somebody that works on hernias. And what I loved about you the most is that she told me that you heard how desperate I was, or for a lack of a better word, maybe desperate I was to my health and trying to get better, that you took me on the next day. You're like, tell him to come right away. And that urgency at that time of my life was I was so grateful for it, because every Western medicine is like, all right, your appointment is within a month. Yeah. And you're just dying within that month just to get an appointment and then get no answers. Whereas with you, I went there the next day, and right away you saw how fragile I was. I think I shed a tear or two there, and you were just so helpful, and you were educational as well, trying to teach me what was going on. And it felt very hopeful. Like I told you, I'm running out of hope. Everywhere I go, I'm running out of hope, because this sounds like it's going to help me, but then it doesn't. And then you had so much education of why you believed it will help me. And if you don't mind, and if you remember, because I know you've dealt with so many, do you kind of remember any of what was going on with me and all that stuff?
Yeah. I mean, it was a few years ago, right?
Yeah.
At this point.
A few years ago, yeah.
But I know your digestive complaint was just shutting you down. You're shutting you down emotionally too. And I think, depression was setting in, right? Stress, fear, anxiety, and all of that. Yeah. So when we were treating you, obviously, it was stomach treatment, it was nervous system treatment, it was, and you had Christy backing you up with all of your holistic nutrition. And so, those are the details that I remember. Anyway,
Yeah.
I just remember being more emotional, psychological than physical at that point. I think it just beaten you down long enough that you were giving up.
Yeah, no, definitely. And what I think what I liked the most was that it wasn't just adjustment stuff. Your practice is very niche, would you say, like in what you do? Yeah.
Yeah, we're fairly specialized in our approach.
Yeah. Can you talk a little bit about that, other than like, or aside from the adjustment stuff, like what is it that you guys also do?
We are a spinal curve correction office, and a lot of chiropractors will say that they work on spinal correction, but our approach is pretty unique and different, even out of those folks. Right? We give very powerful adjustments. That's the foundation of any good chiropractic office is literally adjusting the spine, getting the pressure off the spinal cord, getting that flood of energy to start rushing through the body, right? But then you have to keep that pressure off. And so there's a series of exercises that we do, right? There's adjustment protocols, and then we do a lot of spinal traction as well. And again, a lot of people hear about spinal traction and think about spinal decompression, which is where you're like stretching the spine, right? Pulling it straight, which is good for disc herniations, that kind of thing, acute pain. But the spine's supposed to have natural curves. And our daily practices, our habits, our activities, they're just destroying our normal spinal curvatures. And so we have specialized traction units that will physically bend the spine back into its normal and optimal shape. And so that's when you get the spine back into a normal shape. That's when the energy from through the spinal cord is free to just flow like a river of energy rushing down out to your whole body and controlling everything. So on top of doing adjustments and exercises, we do, like I said, in-office traction, home traction, exercises. It's the full, basically, spinal rehab routine where you're regaining your life and health.
Yeah. I think what I love about it is like, or the downside is like, if you're not fully in, you won't get the full experience. And what I mean by that is when I went there, I was like, whatever you want me to do, I will do it because I want to get better. So all the exercises you had me do before my actual traction appointment, even at home, I was religiously doing it because I wanted to get better. And it was a 3-month, 3 times a week. And that's just for me personally, treatment. And it wasn't until the last week of that 3 months where I started to feel better. And it was.
So it's amazing because I got into chiropractic because my chiropractor from a young age just literally helped our bodies be strong and heal everything. First of all, we don't heal anything as chiropractors. It's literally the human body and the human potential that heals everything, right? We have this innate intelligence inside us that knows how to fix pretty much every ailment and condition that we have. So it's only my job to allow you to express your life force so that you can be strong and healthy and express the best you ever, right? And so that's why I got into chiropractic. And as I started practice, everybody comes in for pain, right? And, you give somebody a couple of treatments and a couple of adjustments and their pain starts to go away. It's actually, we're really good at helping treat pain, right? And that's how I started practicing a lot of the early years in my career. Even though I had in my heart, I was doing it for health and health promotion, it ended up being more of a pain style clinic, which is where most chiropractic offices these days, unfortunately, fall into, is treating pain. That's what insurance companies will pay for, is pain, or if you have a symptom and a pain, they'll pay for that, right? People come in because they have headaches and low back pain, so they'll pay for that. So that's what people end up getting pigeonholed into. And as I was having this pain style clinic for a lot of years, I did a lot of nutrition stuff as well. We started taking x-rays on, obviously people of all different ages, but we didn't x-ray everybody all the time. Until one time I had this teenager come in. It was actually Dr. Reza, my old partner at the time. He was his patient, and she came in and he took an image of her spine, and she was 16 years old, and she had a reversal of a normal curve in her spine, disc degeneration, and bone spurs.
At 16.
At 16. And we looked at it and we thought, holy crap, right? The postures that we're seeing in kids, right, are atrocious. Then at that point, we started looking at, okay, we need to start imaging more people and start seeing what's going on. So then we started imaging more patients as they were coming in, and we were starting to find these atrocious spinal curves with degeneration happening at earlier ages. And then we started looking at all the kids on all their phones and those big backpacks. Then we started imaging the teenagers too, and we were finding that, I don't even know what percentage, but probably half of the teenagers had disc compression already as a teenager, right? And at that point, my healthiest patients, or that had the healthiest spines, were in their 60s and 70s, and the people that had the sickest spines were in their 20s, right? Because the people in their 60s and 70s grew up in a world where they weren't in technology, they weren't staring at a phone, they weren't sitting at a computer, they grew up playing outside, they developed healthy spines, and now we were in a generation of kids that were developing unhealthy spines, unhealthy curves, and they were breaking down. So give them 20, 30 years. I mean, if you want to have financial security, become a spinal surgeon, because this whole generation are all going into surgery in their 30s and 40s. There's no way they're going to make it beyond that. No way. My point of this is that was the point where it was the oh shit moment. Like, I'm treating these people, but their spine and their health is deteriorating. I'm helping them with their pain, but we're not truly helping heal them. And so we started looking at what techniques were out there that would actually help restore these spinal curves and help them regain their health. And that's when we found the technique that we use, which is called chiropractic biophysics. And they have gotten more research than any other spinal regenerative technique out there. They've got hundreds of published studies on how to correct a spinal curve, procedures behind it. So we started implementing that, and just to see how we could start changing these curves. Well, it's a spinal rehab program, right? You're not going to rehab anything in a 2 to 3 week period, right? You come in to me for pain, give me 2-3 weeks, and I'll get you back running again. But if you're going to rehabilitate something, I mean, just the word rehab, nobody's ever gone into rehab for 3 weeks and had any success, right? It takes work. So when we started doing the spinal rehabilitation and treating people over a 3-month period for multiple visits, that's when we started noticing that not only was their spine correcting, but their health conditions just started disappearing, right? The true essence of chiropractic, which is what it was founded on, was release the power of the body to heal, and the body will heal, right? And most of the time, the reason the body is sick is because you interfered with that energy in the first place, right? Because if you're shutting down the body's ability to communicate with something, it's now going to be functioning at a suboptimal level. You start functioning at a suboptimal level, now the door's open for, any kind of assault, right? So we started seeing these conditions disappearing more. And so then it got to the point where now on our intake, it's, we do a full head to toe assessment, and it's not just where are your pains, but, the upper part of your thoracic spine, nerves wrap around your chest and go down your arms. They also go to your heart and lungs, right? So how are your heart and lungs functioning? Any arrhythmias, palpitations, high blood pressure, your lungs, you have asthma, are you prone to chronic bronchitis every time you get a cold? You have low back pain. Sure, it causes low back pain. Those nerves also go down your legs. So are weakness, numbness, tingling in the legs, right? But those nerves also go to an organ, right? Every nerve carries 3 signals. It's going to carry a motor signal, which is going to control a muscle. It's going to carry a sensory signal, which is going to let you know what's going on, right? Pain, numbness, tingling, that kind of stuff. And then it's going to control an organ. So if you have enough pressure on a nerve that it's going to scream at you in pain, there's no way it's not affecting the other 2 components of that nerve, because that pain portion is only the tiny little bit of it, like 10% of the nerve. The other 90% of the nerve is controlling muscles and organs, right? So that low back pain is also affecting your large intestine, your bladder, your reproductive system. So we see that all the time, chronic constipation, diarrhea, irritable bowel, the amount of people that you ask, do you have bladder leaking with coughing or sneezing? I'd probably say 50 to 60% of the patients that walk in my door. Just people don't talk about it. Frequency of urination, can't hold it very long, or leaking with coughing or sneezing. Menstrual issues, infertility, erectile dysfunction, all that stuff. We were seeing just, as we started tracking it, after 3 months of treatment, it was like, wow, this person came in with 18 different health problems, and 17 of them are gone within 3 months. And one's still lingering. All right, that one that's still lingering, we're not helping it. Then we figure out who to send them to. Right? That's what I tell people. All I'm going to do is just release the energy, and we're going to see what's going to heal. What heals is related to your nerve interference. What doesn't heal is related to something else, and then we'll help guide you on where to go. So I don't know if that was a long rambling answer
That was
I
amazing.
love it.
to what question that was, but
That was it made perfect sense, and I love how you describe how the body has this potential to heal, and that we're removing a blockage somewhere. That's an interesting concept for me. Like it kind of seems foreign, but when you say it, it's very primal.
I mean, we're designed to be perfect. I mean, we've been genetically mutating for thousands of years, right? And in survival of the fittest, the best human is the one that survives. So if we're continually like
One-upping ourselves.
if we're continually one-upping ourselves, why are we now so damn sick?
I always think that.
It's like we've been perfecting ourselves for thousands of years, and now we suck.
Right?
It's like we should have sucked at the beginning, and now we're amazing,
yes.
right? And we just look at our health the wrong way, or it's part of because we're in this medical paradigm that we're treating medicine as a healthcare system. Medicine is not a healthcare system. Medicine is a sick care system. It's phenomenal at crisis, right? If you get hit by a car, you have a heart attack, you've got an emergent situation that you need to stay alive, man, you're in the best country in the world. If you want to stay healthy, you're in the wrong place.
Yes.
Because medicine does not make you healthy. It's just not. It's not designed. It's designed to just literally keep you alive and treat the symptom, not to get at the problem. And people even look at it now and say, well, I've got this. There's this screening. My doctor's doing screenings now and finding stuff. So it's more health. Health prevention. I'm like, no, that's not health prevention. That's just early detection.
Yes.
Right. Health prevention is keeping you living at 100% vibrant so that stuff never exists. And that's really fundamentally where true principled chiropractic works into it. When I say principled, is our field is very divided. In the sense that some people only want to treat pain and sports injuries, right? But they haven't necessarily seen the power of what happens when you release the human potential. That's what they've gotten pigeonholed into. We also all get lumped into chiropractic, whereas if you look at medicine, you've got 20 different specialties inside of medicine that everybody knows about. Even in orthopedic, you've got your shoulder ortho, your knee ortho, your low back ortho, right? You've got your pediatricians, your endocrinologist, your dermatologist. You've got all of that. Whereas in chiropractic, it's just chiropractic, right? But within chiropractic, we have so many subspecialties that people don't know about. We have some that are phenomenal in nutrition. Some do sports injuries. Some do spinal rehab. Some just do energy work. Some will adjust you manually. Some use an instrument. Some use a computerized something. So when people go to a chiropractor, they don't know which one they're going to, right? Whereas when you go to a doctor, you know if you're going to an ortho or a dermatologist, right? But then people go to a chiropractor and they're going to the chiropractor and they assume that all chiropractic is what that person did, and it's not necessarily the case because we're not defined that well in the public eye. So people have a very different experience when they go from one chiropractor to the next. And even I will refer to another chiropractor for things that I'm not good at or that I don't do anymore, right? I used to do sports injuries and nutrition. Got a degree in nutrition. I don't have time for that anymore. I love talking about it socially, but in my practice, we do something very specialized and specific, and that's what I'm going to do. And I'll send people for nutrition to somebody like Christy, right? Or another chiropractor that does that. A lot of chiropractors will do muscle testing, applied kinesiology. There's so much out there.
Yeah. I think that's why I'm grateful for that hernia, as crazy as that sounds. Because if I would have heard like Chris say, oh, I know a chiropractor that can help you, I'm like, I already go to one of those. It doesn't help me, So I'm grateful that I had something else that got me in your office. And then all the education that you just told us right now, like I remember being in your office and you explaining all the things that were like, what's going on, what's connected. The one thing I remember you saying is my spine was so bent forward, and you described it as like a water hose. When you twist the water hose, the water stops flowing correctly, and that's how the nervous system works. Yeah. Is that I'm bending and I'm pretty much putting a knot in my nervous system, and so they're not going in the right direction. They think something's wrong. You're getting the panic attacks. You're getting the heart racing and all that stuff. So that's the way I tell people. Hopefully I'm doing you right.
You know what? It's funny because that's an analogy that some chiropractors, it makes them cringe. Really? Oh, the kink in the hose analogy. That's the worst analogy just because it's accurate in the sense that your spinal cord is an extension of your brain, right? And so it's all your central nervous system. Your brain, your spinal cord, it's the same system. They're not two different systems. And your spinal cord comes down through your spine and it anchors at the base of your spine. If you're tractioning or pulling it forward, you're putting tension on the cord. Right? Nervous tissue is the most delicate tissue we have. You're not going to traction it and stretch it without decreasing the potential of energy going through it. And the studies out there all over that show that, right? Energy will get through because it finds a way, but it's not as fast, it's less efficient, all right? So like with you, that posture going forward, just tractioning your system, putting all that cord under all that tension, just turning, analogy, fire hose into a garden hose, right? You're just not getting that energy through there. And that's what we run on. We are electrical beings. We live on life energy, and we produce it in our body. And that's how our nerves communicate signals.
Yeah. The way I knew that I was getting better was I came in there also every day feeling like I was on a boat. I don't know if you remember me telling you that, where literally the floor felt like it was moving. And the only way I would function is because I knew it wasn't moving. But it would give me, it's a discomfort. Like it's not normal to be on solid ground and then you feel like you're on a boat. And it wasn't until that third week, that's where you went into that rant. Well, I was telling you, it wasn't until the last week of the 3 months that I started feeling better. Yeah. And then we did another 3 and I was very determined to just get better. And I saw it work. And oh my God, I remember so much that moment. I was so happy and joyful that I was like, oh my God, this is working. And yeah.
But I mean, you dedicated and you committed to it, right? And you did your exercises, you did your homework, and you did the things that you need to do, right? Nervous tissue, it almost seems like a design flaw. The nervous system is the master system in the body. It controls everything, right? But it's also the most delicate system in the body. Like nervous tissue is so delicate that it takes time for it to regenerate. So as we're doing spinal correction on people, some people, like we'll tell them, listen, your spine is so bent, I literally have to get the tension off the cord and then give it time to heal, right? So sometimes we'll actually do some curve correction and now the tension is off the cord and the healing process is starting. So now like I may dismiss them from care, right? I don't need to work on it for correction anymore and their body's still healing and it still heals and heals and heals and heals. And they're like, holy crap, doc, I just continue getting better and better and better. But yeah, because now your body is turning back on now and it's able to function properly. It's huge.
Doc, I have a question. So anytime I'm introduced to a new treatment modality, we had nutritionists on talking about holistic nutrition. My brain always goes to, if this is a need that we've had throughout history, how was it addressed in different parts of history? So for example, let's say 100 years ago, dental needs were met by the barber. The barber used to be the dentist and they'll yank out the teeth and stuff like that. And then we need therapy. Back in the day, they had very deep connections in villages and stuff. And that's how their therapeutic needs were met. How were chiropractic needs met before the chiropractic industry was invented?
So, I mean, I guess the oldest history of it would be like bone setters, old school bone setters back in Asia, right? Chiropractic was really more founded in the late 1800s, right? And prior to that, my argument would be that, if we were all living what the human was designed to do, if we were hunter-gatherers out foraging, traveling 6 to 7 miles a day, being nomadic human beings, really, we wouldn't need chiropractors that much, right? Because that's what we're designed. We're designed to be active. We're designed to be moving. We're designed to be eating healthy foods, natural foraging. I think a good paleo diet is the one that makes the most sense. Fruits, vegetables with meat, traveling around, not sitting in computers, not breathing in, consuming toxins, not sitting in cars, not stressed out about our finances and doing all those things, right? So those things create postures that create stress on our spine and nervous system that I don't think used to exist as much, right? Obviously there was injuries and things would get out of alignment and they probably had some guy that would pick them up from behind and jump up and down and crack their spine and they probably felt good for it, right?
Yeah.
But they didn't have that chronic spinal degeneration that we have. You know what I mean? They were getting injured, but they weren't having the chronic postural distortions, right? And I believe it's our chronic poor postures that create the most amount of damage to our health rather than sports injuries, slip falls, all that kind of stuff.
Very
Right.
interesting. So they had less of a problem to begin with.
Yeah, I mean, I would say they had much,
Yes.
because they were living a more active, healthy lifestyle. Like I said, when I was talking about looking at the health of the spines in my office, you know, I have 80, 90-year-old patients that still have beautiful, healthy discs and a normal curve in their neck. But yet I've got teenagers that are breaking down and degenerating, right? So, you know, we're in an epidemic now of atrocious postures, and I think it's worse now than it's ever been. So I would argue to say that, you know, a tall, standing, proper individual back in the early 1900s, not at a computer or a desk all day, probably had a hell of a lot better shaped spine and less stress on their spinal cord.
Wow. Very well
As
said.
far as
Doc.
how they fixed it, like I said, I know there were like bone setters back in the day, and who knew what other person would just walk on your back and pop things out and get kinks moving, right?
Yes.
I'm sure that went on. Yeah, that happened quite a bit.
Yeah, absolutely. So, Doc, when it comes to me appreciating chiropractic work, this is a modern thing for me. I wasn't really aware. Like I knew that when I was younger, I knew the doctor, I knew the dentist. Those were the very more prominent forms of treatment that everybody needs. You got to go visit. And then as I matured, maybe first time ever knowing a chiropractor existed was like 23, 24. Chiropractors, they make your back straight, your spine, this is that. And it was a new concept to me. Like it was just a new thing. And I'm like, why is that important? Why is having your spine aligned important? And now I'm at a point where, because I'm a filmmaker, photographer, I'm starting to recognize posture in my photographs. Like a lot of my posing is like, for the groom in his wedding, they bring your back up straight. And I'm starting to recognize that not only am I appreciating chiropractic, I recognize that bad posture gives the image of a lack of confidence, of incompetence sometimes. If it's like a really slouched over, like you can tell that this person, all they do is slouch over a computer or sit over a gas station, a little tray or something. It just, it says a lot of, your posture says a lot about you.
Absolutely.
And, as a photographer or videographer, I'm starting to even incorporate that in my directing, and I start to see that and the importance of good posture. What are some stories that you may have of, patients that came in and have their posture corrected, and what impact did that have on their life? Just walking around with better posture.
Well, I mean, kind of like what you just said is that people will look at somebody's posture and automatically assign a level of confidence or health to them. See somebody slouched over, it's like, oh, it's not a person, right?
Absolutely.
And so there's, as far as confidence goes, I mean, when you're feeling better, you're feeling stronger, you're feeling more energetic, and basically you just don't feel like crap all the time. One, you're a prouder, taller human being. And so we see that, I guess what the question was, some experiences, I guess.
Maybe a reaction, maybe somebody telling you like, maybe they got a job or.
I mean, people look at their pictures and they're like, oh my God, Doc, I stand so much better now. And I saw this picture of me and I'm taller than my mom than I used to be. I was shrinking before and now I'm not shrinking anymore. Definitely a lot of confidence and a lot of energy, right? And it's funny, from a photography standpoint, we have some patients that come in and their motivation is they saw themselves and they don't want to look that way in their wedding photos.
Mm.
And that's their goal, is to get rid of that hunchback so that they're not that hunchback in their wedding photos. Obviously there's a lot of pride and happiness when they accomplish that.
And I also feel like, Doc, sorry to cut you off, but I also feel like it works the other way around. Sometimes, like my posture is not the best, but when I've been on top of my diet and on top of working out when I worked out in the morning, I will walk around with better posture that day as a form of self-expression. So it's like it's a two-way street. It's like the way you live your life and your posture, and they both influence each other.
Absolutely. Yeah. I mean, when in chiropractic, we talk about subluxations, right? A subluxation is when your vertebrae slips out of alignment, right? Or shifts out of alignment. That shift out of the alignment, usually say there's three causes of it, right? There's physical causes of a subluxation, there's chemical causes, and there's emotional causes.
Emotional causes.
Yeah. So in the sense that your posture, just like you talked about, you can look at somebody's posture and see if they're sad. You can tell a proud person, right? You can tell an angry person, right? They get in that. So our emotions are going to change how we are going to compose ourselves in our posture and the amount of stress that we're going to have on our spinal cord, right?
Very interesting.
So a depressed person, if we're working on them posturally to try to get them out of that rounded forward posture, you've got to work on some emotional stuff as well, right? You have to get them out of that, find a way to help them get them out of that depression, right? Whether it's a therapist, recommending meditation, different types of things, and also healthy diet. Chemicals, when our body's toxic, we're more prone to injury because our muscles are tight and taut, more like beef jerky than they're like a filet mignon. So toxins that we're taking in our body are also going to put stress on us. They're going to pull on things they're going to make us more prone to injury as well. So that when you're working out, one, you're breaking down stress hormones. Exercise helps breaking down stress hormones. So you're going to be in a better, lighter mood, right? You're activating muscles. When you're lifting, you're activating your postural muscles because you don't typically get into a slumped over bad posture and then lift. You get into a good posture and then lift typically, right? And so that's going to activate all those postural muscles. So yeah, you're setting yourself up for success. One, you've got tight, good postural muscles. You broke down a lot of those stress hormones where you're just living light and happy. You feel good about yourself because you got your butt up off the sofa and you worked out. So yeah, you walk around all day just tall and proud, right?
Sounds like you.
That's me. When I work out.
When you work out, yeah. That's so funny. I remember walking into your office during that time period. I felt like I was Eeyore. I don't know if you know who Eeyore is. It's the depressed donkey from the Winnie the Pooh series.
But, yeah, I know that guy.
Yeah. And that was me every single time because I was going through it. You know what I mean? It's like, I don't know if it's going to work, but I'm just here. And it was just being a hopeful thing. But it wasn't until now when I go to his office, there's a smile, there's a pep in my step, there's a smile in there. I walk in there, I see him, great smile, and then he corrects me and I say hi to everybody and I'm gone. Like it does make a difference once you start feeling like better and it's like, oh my God, like you remember taking these steps to the door as a very like just sick and hopeful person that this is gonna help, and now it's to the point where it's like I'm happy to get to your office, do my thing, and then go straight to shooting weddings. I try to schedule my times on Fridays because we shoot weddings on the weekends. I get adjusted and I'm shooting weddings and I feel great. Yeah.
I feel like weddings are probably the most taxing on my spine because of the amount of stress. Like and we're very different. So he has a lot more experience. He's a lot calmer in weddings. I'm maximum fight or flight and I have to cultivate that energy hours before my wedding. I'll start like chugging coffee and getting into that fight or flight state because that's how I operate my best. And I feel like I'm just the snappiest. But the problem is when I'm done with the wedding, I need like 5 to 6 hours to go back into my parasympathetic. Like I need hours to wind down and be able to fall asleep or just relax. And I feel like my back pain for a week after that is flaring. I have weird muscular tension in my back and my neck. And it's actually the worst after a wedding.
Imagine.
Yeah.
I mean, you're tasking, you're stressing your body. And if you already have pre-stress on it, you have any tension on there, you're just going to amplify it and throw a spotlight on. You're carrying equipment, bags on you, hanging on you, probably getting in weird positions, running around, and like I said, getting yourself amped up.
Mm-hmm.
It's a lot.
And as your friend, have I known about this? Yes. And as your friend, have I invited you many times to Dr. Tony's office?
Yes,
I have.
And I'm going to do
just
it.
So they know, it's not the first time me hearing him talk about this, and I have invited him to go see Dr.
Sergio's been trying to fix me as much as he can, and I'm trying to be as receptive as I can to all the advice. I'm just not as advanced as he is when it comes to...
I just don't ever want you to deal with what I had, because we're in the same field, right?
Yeah, you're right.
We carry cameras in front of us. We carry gimbals and lights and everything. And the whole experience with Dr. Tony and what I went through, it changed the way I shoot now. So whenever one of my colleagues for the first time come shoot with me, they're like, oh, that's interesting how you have that. I'm like, bro, I changed my whole way of shooting because I no longer put all that stress in front of me anymore. No. Yeah.
And that's one of the keys of helping anybody repair and regain health, right? Is I didn't follow you around and tell you how to hold your camera, but you have to change those postural bad habits to not recreate the problem once we fix it, right? And as your body does get strong and healthy into a proper posture, every time you get into a bad posture, bad position, you start to recognize it. You're like, oh man, that's dumb. Why am I doing that?
Mm-hmm.
And then that's when you start fixing those problems. When you start fixing those bad habits, you don't do them anymore, then you don't recreate the problem like you did in the first place.
Yeah.
And that's part of, like I said, part of true correcting something.
Yeah.
Is you got to fix what caused it too, right? You got to stop doing the bad habit.
Yes.
So, which you did, which you naturally do once you recognize that it is a bad habit.
I told Karina, my fiance, I was like, I'm sorry, but I think about Dr. Tony more now often, because if I'm in a bad posture, I hear his voice and I'll automatically correct it. And that's everywhere, every day, man. It's cool. Yeah. Cause he, like I said, he teaches you and you're just so much more aware and you don't want to get back to that, habit. And so you're all constantly just correcting your posture.
Yeah, it's huge.
So important.
It's huge. It's amazing. I do want to ask you, Doc, and this might be a hypothetical situation or may not have an answer, but I do want to ask it. One of my things is that my traps here, these muscles, whenever I'm stressed out, even though they're not in function, like I'm not carrying something, like there are times where I work out my traps at the gym, that's something, but there's me being stressed out because of a bill I have to pay or because of something I have to do. And I notice at the end of the night that these things have been flexed the whole time. Why does my body do this? Like, why does my body choose to flex those two muscles?
I'll say probably two reasons, right? So let's go first with your head's a bowling ball. Male head, 15 to 20 pounds. Okay. 15 to 20 pounds, and it's designed to be held like a waiter or waitress would be holding a tray, right? Curve and sitting close
Slings
to
back.
Yeah, curve sitting close to the body, right? You can load that with a tremendous amount of weight, and it's not a problem. If you lose the curve and you now start holding it out in front of you, now you're having to use your muscles to hold it up, right? So anytime your neck is not curving backwards, ideally, and your ear's not over your shoulder and you have that curve, you're now activating muscles to hold your head up, okay? And just like carrying a purse, a bag, anything, the further in front of you you put it, the heavier it gets, okay? So the way the physics of the spinal curve and the neck work and your head work is every inch your head goes forward, the weight of your head doubles. So if your head is in ideal posture, if you're forward 1 inch, your 15 to 20 pound head is now a 30 to 40 pound head.
Whoa.
Now you go forward another inch, now you're looking at 60 to 70 pounds, okay? You're not just holding that up for a moment, you're holding that up all day. So now what you're doing is you're taking a muscle that was designed to control and give you gestures and motion, and you're now using it like a marathon running muscle that's just working all the time. So it's getting more taut and more taut and more taut. You're going to start to change the integrity of that muscle. You're going to change the muscle fibers of it, and where they're just going to be taut and tight all the time. Okay, so that's one thing. They're just constantly being loaded, so they are going to be tight at the end of the day. That's why everyone wants their shoulders rubbed. It's like, oh my God, rub my neck, rub my shoulders. Or they don't want to rub because it's too damn sensitive. Like, God, don't touch me, right? But that's the scenario, is that we, as a society, we all have these tight necks because we're not using it posturally correct. So that's one aspect. Second aspect, fight, flight, right? That tuck and hide, protect yourself. Fight, flight, if a tiger is chasing you, right, you're going to run. If the tiger catches you, you're going to ball up. You're going to instinctively protect.
Contractile.
You're going to contract. You're going to protect all this vital stuff, and you're going to protect your organs. So somebody throws something at you, this is like it's ingrained.
Go-to.
That's ingrained in us.
Yeah.
Right. And so if you're going to be living in a tight, stressed state all the time, it's almost more natural to get in here.
Wow.
Right. And so when you're talking, one, posturally, just preloading your spine with all that tension, then two, a stressful day, I believe it's thousands of years of genetics of fight, flight, defense, that's our postural fight, flight state.
Wow. Mind-blowing stuff. That is so cool. Because the first part, it's a physical explanation, but that second point you made that was my curiosity. Something's going on here that is more than just function, and that makes sense.
There's a chiropractor, Dr. James Chestnut, and love that guy. He's phenomenal, but he does a couple talks on eat well, think well, move well. You're YouTube that, look that up, and that talks about that a lot, about basically our fight flight response, and how that's affecting. It can be affecting our posture as well as affecting the hormones that we produce, right? And we're living. We wonder, we have high cortisol and cholesterol. Right? They're stress hormones. Wound clotting and healing is what they're designed for. So we have these heightened hormones because we're living in this constant stress state where we're just not designed to be living in these stress states all the time, right? We're talking sympathetic dominant before, right? Our sympathetic response is our fight flight state, where that's designed to kick in when we're in go mode and run and get away or stay and fight, right?
Yes.
But we live in that constantly.
Yes.
And we have so many patients that live in that state constantly as well.
Yeah.
Also, posturally, when your head is forward and extended, you're putting pressure on the sympathetic ganglion, which comes at basically at the top of your neck. When we start treating people, actually with you, Sergio, we were getting you out of that sympathetic dominant state and getting your body into the parasympathetic state where it would get out of the crisis state and actually start healing. We were doing that through you posturally, getting the tension off. But so many people are just, like I said, constant sympathetic state.
That's me.
Stressed all the time.
That's me. Like I can recognize when when I had a night's sleep where I felt like my body actually dipped well into the parasympathetic, because 9 out of 10 nights it's sympathetic all the time.
Yep.
And anytime I have those 2-3 days of recovery, I'm like, finally my body decided to go back. And I know I'm responsible for this. It's not like a victim mentality, but it's really a problem that you're always in fight or flight.
Well, and that's it. And a lot of people don't realize that when you're in a sympathetic dominant state, when you're in a fight flight state, your parasympathetic is basically getting shut down, right? And so, again, to quote Dr. James Chestnut, when a tiger's chasing you, what's going to happen, right? Your heart rate's going to elevate, your lung capacity is going to basically increase, your hormones for wound clotting and healing are going to be elevated. So if the tiger does catch you, you can clot wounds and survive. So cortisol, cholesterol go up. But what shuts down, right? You don't need to digest your food, right? You don't need to do a lot of internal healing. There's a lot of processes that start to shut down. So that's one of the reasons that so many people are, not breaking their food down, have digestive problems, have fertility problems, have, all these other things, is that those systems don't need to function when you're stressed out. Right? When you're in a stressed state, you don't need to digest your food. You need to send strength to your muscles and your heart and lungs, right?
Very interesting.
But not your digestion, not your fertility. None of that stuff needs to matter.
Yes. Very, very interesting. Doc, I do want to go into a topic. I don't know if it's appropriate or not. If it's not, we can drop it. But this wasn't a thing when we were 20, 25, 18. But now that I'm going to my 30s, when I'm talking to my friends that are my age and older, if a chiropractor gets brought up, it's usually because they're having some sort of sexual challenges that eventually led them to a chiropractor.
So an infertility or an ED ended up
ED,
in the chiropractor. Okay.
Things like that. And that's usually, when I hear chiropractor, I'm like, all right, so usually.
Do you think ED when you hear chiropractor?
To be honest with you.
Honest to God, I would much rather people associate chiropractors with ED than neck pain, low back pain.
It's that intense.
Yeah, absolutely. Because neck pain, low back pain is such... It's boring.
That's what you mean. I know what you mean.
Well,
okay,
also, it's so far down the chain. I mean, by the time you have neck pain and low back pain, you've had months, years of a problem. Unless you have an acute injury, right?
Right.
But pain is your body's check engine light. It doesn't show up until you've leaked all the oil out, and now it says, crap, you're going to shut down, and then it starts screaming pain signals at you. But before you get the pain signals, you start to get the organ dysfunction. Right? So ED is more organ dysfunction problem that will start to show up typically prior to the pain showing up. So at least people are finding the chiropractor during the organ problem rather than the low back problem, right? So yeah, that's why I'd rather us be associated with ED.
Say some names, bro. Say some names.
Yes.
So the question. Go ahead. The question about that.
So this is a strong association I have, right? Okay. We're going into an older phase of our lives, and we're starting to face new challenges. People are getting married, so they're being tested in that department of life. and they're starting to face challenges, and they go through the system through doctors, and they find themselves with a chiropractor. What is it about the chiropractic work, the nervous system, that is so crucial for sexual function?
Like we were discussing earlier, low back pain, the nerves of the low back, right? Low back pain is a very common thing that people experience, right? 80% of the US population has back pain. But the nerves out of that lumbar spine control your reproductive system. So in women, it's frequent your abnormal menstrual cycles, right? Frequency, duration, intensity, or infertility. In men, it's erectile dysfunction, right? So if you have enough pressure on those nerves, I mean, everything's controlled by your nervous system, right? And the nerves, they don't run externally, they run through the spinal cord to get to the organs. So if you have pressure on that nerve, it's not getting the proper signal. Is that
So it's not just circulation. It's
not just circulation.
Okay.
I mean, everything's controlled by your nervous system, right? And so if you're trying to get your function back, especially as a guy, where's the interference, right? Is it nerve? Is it blood flow? Is it hormones? Is it stress? Like, what is it? There's a lot of different things that can affect it. Nervous system is one of them for sure. And so we see that all the time.
Yes.
And when people restore their nervous system strength, we also see function restoring too. So I'm glad that your friends that chiropractic, when you hear it, that's where your mind goes, because that is something that said the human body is supposed to function normally. It just is. So find the interference, get rid of it, let it function.
I love that. Let's say, what is a type of exercise, an activity that is just so pro spinal health? Like, please do more of that.
I love rowing. I tell my patients, if you see a rowing machine in the gym, use that as your warm up. Do 5 minutes on a rower, all right? Because with rowing, look at it this way: flexion is death, extension is life.
Yeah.
Right.
Yeah.
All your exercises that are bringing you into flexion is your demise. Anything that's bringing you into extension that's where life is. You see it. You see, people with that hump in their upper back. That's a trigger, especially for women. No woman wants that. That hump in their upper back. And I know that from experience, because that's something I hear from my patients all the time. Massive concern. Men, none of them want to look like the old man that's hunched over, rounding forward, that's kind of like hobbling along, right? Those are all flexion postures, right? Extension is where you need to be. So every day is back day. There's no such thing as leg day only. It's leg day and a back exercise. It's chest day and a back exercise.
Wow.
Everything with our postures that we have, everyone needs to be doing some exercise contracting your scapula, your shoulder blades. Shoulder blades need to come back and down, and that's what needs to be contracted. So if you're doing a day of chest, throw in one set of reverse flies, seated cable rows.
Yeah.
Right. And that's why I like the rower as a warm up, because rowing is you're going to activate your abs. You're going to activate your spinal extensors. You're using your arms, you're pushing with your legs, and you're contracting in between your shoulder blades. So 5 minutes on a rower warm up, as opposed to running on a treadmill or on a stationary bike, which you're just going in circles. You can at least activate your whole body. You'll get your heart rate up, you'll warm up more muscles, and you're going to activate those extensors, right? Those back muscles. So I would say use that as your warm up. And then every day, no matter what day it is, even if you don't go to the gym, go on to Amazon and buy a set of resistance bands for $40. You'll get a set of 8 different bands of all sorts of different resistance. Start doing at least a rowing exercise, pulling back, right? Or there's YWTLs, which is where you're going band, you're pulling backwards, there, and then down, just activating that part of your spine. That's what I would recommend for 100% everybody.
Wow.
Back day every day.
Back day every day.
I love
it doesn't have to be but at least one exercise.
Yeah.
Especially on chest day. Because chest day, you're going to walk around all day with those tight muscles in your chest just pulling you forward, right? And you got to do something on the backside to keep it strong on the backside.
Yeah. What are your thoughts on, because I just got into cycling and excuse me. And because I know about the whole posture thing, sometimes while I'm cycling, I think about that. I'm like, I'm bent the entire time.
Yeah, you are. I think about it when I cycle too. I'm like, just try to get those shoulders back.
Yeah.
And make sure you're focused on the head being up.
Yeah.
Right.
Because and then you have a helmet on, so everything is heavy and in front of you. So I guess it is what it is kind of deal. Just get your exercise and then get back home and do something for the back.
Exercise and do something, get some extension exercise for the spine.
Yeah. Well, I mean, I'm special. I have the blocks.
At least when you're cycling, you're keeping your neck and your head in extension.
Right.
Right. And so you're activating muscles to promote good head posture.
Yeah.
But you do end up rounded forward in your thoracic spine in that middle part of your back. Right.
Yeah.
But it's really, I've tried leaning forward and getting that extension in while you're biking, and you can do it, but you end up rounded forward.
We're gonna need those Harley
ape hangers.
Yeah, for your road bike.
Yeah, there you go.
The least aerodynamic device ever created, but it's great for your back.
Yeah, exactly.
Doc, since activity plays a huge role and leaves an imprint on our posture and our spinal health, something we do half of our lives is sleep. Mm-hmm. I assume that the way we sleep, the position in which we sleep, has a huge impact on our spinal health. Is that accurate?
I would say, yeah. Sleeping, the one thing about sleeping is you're not activating muscles and you're not stretching tendons to their elongated point, right? Which we do with our poor postures. So you're going to do more damage in an awake poor posture than you are when you're going to be laying down, okay? Because again, you're not activating muscles and supporting and holding. So sleeping posture is really important. I've got a lot of colleagues that are way more obsessed and anal about sleeping posture than I am. I am just not as anal about sleeping posture as a lot of chiropractors may be. Don't sleep with massive pillows. Don't sleep with your head super flexed forward, right? As your head is flexed very far forward, it's going to stretch your tendons and ligaments. But sleep comfortably.
Okay.
Love that.
That's huge.
Yeah.
Well, that's it. Tossing and turning. I've had a patient come in today. His strained his neck. Woke up with it that way. It's like tossing when you're uncomfortable and you're tossing and turning is when you're laying down and you want to roll over. You initiate your motion by pushing off with your head,
which is a crazy amount of force.
Which is a lot of force. Which is where people, when they travel, will frequently they talk about their pillow. They're not sleeping with their pillow. They had a terrible night's sleep. They have neck pain. When you're in an uncomfortable bed, say traveling, you're going to end up with a neck ache because you're tossing and turning because you're pushing off with your head consistently. So one, you don't want to be pushing off your head all the time. You want to be in a good posture. I like a good supine posture, right, on your back with a contour pillow to help promote nice healthy neck curve. That's where it's got that bump. Your head falls into the hole. So that really reinforces an ideal posture. On a firm bed, it's got a little pillow topper to take the pressure points out. That would be my ideal recommendation.
Awesome.
Some people are like, I just can't sleep on my back. I'm like, well, we'll try. And there's a couple ways that I think help people sleep on their back. And one is take the pillow from being just behind your head, but maybe move it down to under your shoulders a little bit. So now instead of it just pushing your head forward, it's under your upper part of your back. I think it's harder to roll onto your side and roll around when you've got that pillow there. And also putting a pillow under your knees will help prevent you from rolling over as well. So if you're trying to sleep on your back, which is really, I believe, the most ideal posture, that's probably the best way to help promote it. Okay. But if you're on your side, you want your pillow a little bit thicker. Again, you want good support. The contour pillows, again, I like when you're on your side because it has that dip. And what that dip does is it helps keep your chin more neutral as opposed to curled, right? You're not in that ball, right? So it's going to help tuck your head in there. It's going to support it. That helps keep your head more neutral. Pillow between the knees, keep your pelvis more aligned. That's a decent side sleeping posture. You're going to sleep on your stomach and thin pillow. Right. As thin as you can, try not to look to the same side all the time. And it's probably the worst out of all of them. But if you're going to look at that point, if you're sleeping on your stomach, at least you're pushing your head back into a better posture. So
love that.
So
huge.
Try to do it on your back. And, but also because my patients ask me this all the time. You know, do you think me sleeping in this posture is what's wrecking my spine? I'm like, no, I don't think that's what's wrecking your spine. Is it promoting healthy spine? Not necessarily, but what's wrecking it is your upright, weight-bearing poor postures that's destroying your health.
Absolutely.
So sleep peacefully.
So function is more effective than non-function. Like when you're in a state of muscular function, that has the longest lasting impact.
Yeah, absolutely.
I love that.
Yeah, it's very cool.
Which makes sense because when I work out, when I go to the gym, I'm going to the gym 1 hour a day, but my body transforms within 3 months, and my sleep is the same. So it's like if that 1 hour was able to offset that whole 10 hours of never thought of it that way.
Yeah,
that's huge.
Yeah.
Doc, also again along the lines of our age, people are getting married, they're having kids. Parenting when it comes to the chiropractic aspect of it. How do you guide your children to set them up for, what do you tell them not to do? What do you tell them to do to set them up for an okay start?
Well, one, we check all kids. All kids need to be checked for spinal subluxations and spinal trauma.
Interesting.
Right? Because the birthing process is a very traumatic process. 50% of our babies are being born C-section. Which lends to babies being pulled out of mothers' abdomens, typically from their head with nothing help push them out. So that's a tremendous amount of load. When babies are being born naturally these days is a hospital birth, which always has doctor assistance, right, as the baby's coming out. So we see a lot of spinal injury during those processes. So one, if you want a spine to develop properly, you've got to make sure there's no misalignments right from the get-go. So all babies and kids need to get checked. It's the most gentle thing ever. Adjusting a baby takes a pinky, a little bit of force, and it makes a massive amount of difference.
Wow.
So
baby adjustments.
Yeah, babies. My youngest adjustment was 3 days old, but a month premature. So I say he was minus 27 days old.
Wow.
Right.
Yeah.
Wow.
And typically moms will bring their babies in after about the first week. And unless there's been an injury. If there's been an injury if there's been a visible injury during birth where they see it right after, which they'll typically see like a torticollis, which is where the baby's head is stuck more to one side, that's instantly, right? Get them in right away. But if everything looks normal, there's no complications, no issues, bring them in, get them checked within the first week, and then at milestones, right? If they're healthy, there's no problems, milestones, lifting head, rolling over, crawling, walking, all of those things, they're starting to use their spine in a new way. And if there are any misalignments, they're not going to use it in the proper way. They're going to start to adapt around it. So just like a little twig that's growing, a little tree, if it's growing bent, crooked, if you don't stake it, it's going to grow into a big crooked tree, right? So you go out and you put a stake on it and you tie it up and it grows straight. Same concept. If there are any kinks or misalignments, called subluxations, right, in a baby's spine, they will grow around that, and they will start to adapt abnormal postural problems around that. Then once they're fully grown, you've grown a spine that's not the right shape. That's really difficult to fix or undo. So that's the first thing. Definitely, the teenage kids, especially females going through, I was going to say menopause. The opposite of menopause.
Yes. Puberty?
Puberty. Young females going through puberty, that's when scoliosis and spinal curves get the most aggressive. That's where we see a massive change in a very short period of time, right? So the scoliosis checks, that's why they do scoliosis checks at school, or used to anyway. I don't think they really do them anymore, and even when they did do them, they weren't very good at them. So that's where, all those females need to be checked by a professional that will actually assess their spine. Boys kind of prepubescent, right? We're starting to identify all the postural problems at that point. So your question, taking a long roundabout a way to answer it.
No, this is perfect. It's for females, boys.
No, kids need to get checked.
Yeah.
Right. People don't think about chiropractors when they think about their kids because they either associate chiropractic with neck pain and low back pain, which their kids don't have, or ED, which their kids don't have, right?
Yes.
So either way, you're associating chiropractic with something that kids don't have.
Yes.
Right.
But to truly keep a kid healthy, or a child healthy, you need to have 100% vibrant energy running through their body. So Sergio, as you know, that vibrant energy running through your body is the difference between living just a happy, fruitful life and one where you're just kind of depressed in that state. Right? So you know the power of the nervous system, so that affects kids too. So it just they don't express it as pain, but sometimes kids do have pain. They'll tell you if a kid ever tells you they have a headache, man, something's wrong. That's like anything.
Yeah.
Right. But in infants, it's ear infections, it's colic, it's digestive issues, chronic constipation. Like that's what we treat the most in infants, are those types of circumstances, those types of situations. But it tends to almost move down as they start to develop, in the sense that babies with ear infections end up as young children with asthma, end up as mid-teens with digestive problems. It's the problem as gravitational, and as issue starts to come, it kind of works its way down. So that's the kid stuff that we see. Now, as posture goes, as far as treating kids, is have some. I mean, kids don't listen to their parents that well, right?
Yeah.
We have already got 101 things we're nagging at them about. Then it's yelling at them about posture. They're
gonna be like, we're out.
We're out. Yeah. And so, and I see this all the time too. And so in my world, we address it by, I have the parents bring their kids to our Wednesday workshop. We do a spinal health workshop on Wednesday nights at my office. We do it every Wednesday. It's at 6:15. And literally we talk about all the data and the research on what proper posture is, what poor posture is, how it affects your health, and not just like mom and dad's opinion, but here's how the body works. Here's how poor posture is going to affect that. Here are the health conditions that can be associated with that. And here are tools that you can do to help prevent that. And the kids that come to the workshop, we have kids come, as long as they can sit still, like 6-year-olds, 7-year-olds and up, they actually sit through the workshop pretty well, and they've got some of the best questions. But they'll come out of it and they will actually be compliant when their parents say, hey, sit upright, because they see, okay, what does it mean when I'm in my poor posture? How is it going to affect my health? And how am I going to function? And all kids, I mean, they just want to be superheroes. They want to be strong, and they want to be faster than their friends, and they want to be better in sports than their friends, right? And they want to be, like I said, they want to look good when other kids look at them, so seeing that they can live stronger, happier, healthier, with a proper spinal posture, you have to motivate them to get them to want to change. You can't just yell at them to stand up all day.
Absolutely.
Right? Which you can, but that's just one more thing you're yelling at your kids for. Right? They need to know the why behind everything. But if they understand the why and they appreciate the why, then they'll make the change themselves.
Absolutely.
Actually, I had a patient in this morning. She's like, yeah, like mom and 2 kids, daughter and son. She's like, who's the best at doing all their home exercises? She's like, my daughter. She's like, yeah. She's like, Mom, I don't want that scoliosis. Because she had a little curve in her spine. And she has a friend who has to wear a brace for scoliosis. And
I don't want to do that.
We're catching it young. And we're going to stop it from progressing and undo it so that that is not her future. But she's self-motivated. She does her exercises and the stuff that we taught her every day.
Wow.
And her mom doesn't even have to ask her. So that's
Goals.
the answer. You got to have somebody else teach your kids.
Yes.
or you have to teach them, right? But you have to know what to teach them so that at least they're self-driven.
Yeah.
Love that.
I think it's one of the things that I love about having, our guests that come in is you can tell like their passion of what they do. And like, I feel that you have so much passion in what you do. You actually study it. Like you go to the science of it all, and you really educate us to really understand what it is that, like, what's going on with our bodies. And that's something that I really appreciate that you do, because again, like you said, like there's so many chiropractors out there, and I feel like I have the top one in front of me, right? And that's just the way I feel, because I can see again the passion and the knowledge that you have, and I'm sure that you study, and you're telling us about someone that you watch on YouTube and how much you love him and what he does. And so it's really cool to see that you put so much time and effort into it, and then just try to help us, people that just don't understand it, and just talk to us like in the sense of like really understanding what's going on. And then it makes us like be more aware. I'm like, oh, my mom's not just telling me I need to stand up straight. There's a purpose and a reason. Yeah. And you're like educating us, and like, oh, okay. Sorry, Mom. Okay, I get it now. You know? Yeah. So thank you for all that, man. Yeah. 100%. Yeah. And your office as well. I really have to give it to you because you have a really cool office that you choose the people that you work with and can really be so helpful to your clients. I walked in there and immediately, I mean, in my situation, I walked in there, again, fragile, but there were always smiles when I walked in. There's always good energy, even from Dr. Hansen that's there and Dr. Reza that was there. I wasn't their client per se, but they were always so friendly with me. Hey, what's up, Sergio? And like, they didn't really know me like you did, but they were always so friendly. And I love that you choose the people that are there that treat all of your patients like if they're their patient. So it's a great office, and I hope everybody just goes in there just to check it out, and then go to your Wednesday seminar so they understand what's going on, and then hopefully never get to the point where they're desperate to need it, and just go in there with already like, hey, I don't know what's wrong with me. Something might be wrong with me, but can we check, right?
Health promotion. Keeping your health is a lot easier than regaining your health. Right? Fixing yourself once you're broken is the wrong model. That's the U.S. model. That's why we are one of the sickest countries. It's really, I mean, if you look at the numbers, there are 30 to 40 countries out there that are living longer, happier, healthier lives. Infant mortality, we are in the 30s to 40s right now, where your children have a better chance of living to 2 years of age in Costa Rica than they do in the U.S.
Wow.
Okay. So we're doing something fundamentally wrong, and you really need to work on, like what you said, just keep your health, maintain it, do those things so that you don't ever get sick. Come in, get checked, right? So that you don't end up waiting too long.
Yeah.
Once it's broken down, it's broken down.
I think it's also the marathon and the sprint thing, right?
Totally.
Like everyone wants the pill that will get them feeling better.
Yep.
But that's not long term.
It's not long term.
Yeah. And I think that's something that I learned with you and Christy is I had tons of questions, and you guys would always just educate me. And then I understood, like, this is a marathon thing. I might not feel good tomorrow, but I know eventually I will. And it's going to be beneficial for me to do the marathon than to try to find the quick fix, but not fix or understand why I even got sick in the first place. Yeah. So marathon over the sprint.
Absolutely.
Definitely a marathon.
Yeah.
Doc, I appreciate you. This has been very insightful. I feel like as you're very gentle and calm with your communication, but you're so like you hit the nails on the head, like so hard. Like all the questions you answered were amazing, and it really got me thinking about a lot of things, to be honest with you, especially about the fight or flight. Like me already being aware that I'm in fight or flight. Now I know that my back pain is a big result of like it's an internal reaction that my body's having to just constantly being in a state of stress. I like it. Like I'm in the phase of life where like I think it's cool, but I know that this is not sustainable. It's amazing for business short term, but I know this is not sustainable. So definitely opened up my eyes. I hope that our guests get to see, our audience get to see this side of health, this side of life. We are called the Visionary Circle Podcast in the sense that we interview people that are passionate about what they do, visionaries, creatives. And I think we call it a circle because everything is connected. And everything does come full circle, you know, whatever it is, be your health, your nutrition, your relationships. Even if you're trying to film a wedding, your posture is going to have an effect on that. Your understanding of posture is going to have an effect on your art and how your photos look. And everything's so connected. And I love that we can be two creatives that interview someone of your stature that is so experienced in this field that not many people, especially our audience, might never get a chance to learn. And thank you so much for that.
Absolutely. On a beer.
Before we leave, I do have
Yes. All right.
2 more questions, and I hope they're quick answers.
Good luck.
1, our kids and phones. What do you recommend, or how? Yeah, like even with your kids, like the phones, you can't take that away, right? They're gonna go crazy without it. Yeah, how do I tell my kid, like, hey, check your posture?
Well, one, I mean, it's a parenting thing in the sense that it's parental philosophy too. My kids aren't that old yet. Got an 11, or 10 going on 11. She doesn't have a phone.
Yeah.
Well, she has a phone that she's very excited about, her phone. That's the phone that she gets to watch things on the airplane.
Gotcha.
Right? So that's it. You got a phone on the airplane. So she doesn't, they don't have phones. And I'm looking at high schools that have no phone policies. Right? And so that's our philosophy on the phone thing. As far as that goes, I mean, it's just not good for brain development either, right?
Yeah.
So then you have to look at the postural stuff. The postural stuff, we have kids in the office all the time, and parents too. We always work on them on how to hold their phone, and it's not down here. We always have them sit up straight, tuck their elbows in, right, and just to hold it up here. Right? If you hold it up here all the time, you're going to exhaust your arms, and they're just not going to do it, right? But in this, arms tucked in here, let them rest. At least it's up in front of their face, and they're not staring down at the ground. So that's my recommendation for kids and phones is.
I got yelled at a few times at that office.
Don't let them have it, right?
Right.
Number 1, because it's going to cause nothing but problems. And then 2, when they do use it, really teach them that posture and teach it to them young, because I mean, I'm not perfectly innocent. When my daughter does get the phone or the iPad, it's not, she doesn't have one of her own. She does, but every now and then, they know that if I see them sitting like this, it's gone. And now when I'm on my phone, if I am in a bad they'll dad posture. And they love busting me on it. Of
course.
I'm like this, and I want them to bust me on it because generally, well, one, I'm not on my phone very often, but when I am, I do want to be in a proper posture. And it's my kids that are busting me if I do get into a bad posture on my phone, because when they do get a device, if they're in a bad posture, it's no.
And when they bust you, at least they're paying attention.
They're paying attention, yeah.
Posture.
And I'll look at them and I'll say, girls, and they'll instantly, they know, right? Said, especially on the airplane.
Yeah.
Right? It's got to be up.
Yeah.
But if you teach them young, then at least it's a habit that they've created. Yeah. So just good habits.
And then last question. What are your thoughts on an inverted table? What is it called? Inversion tables.
So Sergio, you don't have to do that, man.
He has one.
So they have a time and place. I think everything has a time and a place.
Okay.
All right. So there's good in everything. I think everything, but time and place for everything. Inversion tables are good to take pressure off the discs. Right. So it'll help take pressure off. Our discs are like jelly donuts, right? The jelly on the inside squirting out is what a herniation is. So a lot of people that have herniations, when you open it up and decompress it, it can help bring it back in a little bit and give some relief. That being said, our spines were not designed with the fibers associated with them to be constantly stretched out, right? And our spines are also designed to have normal curves to it. When you're laying down, if you're upside down, you're stretching normal curves out of it, and you're also putting a little bit too much tensile stretch on a tissue that's not designed for that. So what does that mean? That means if you're in a whole bunch of pain and the only thing that's really feeling good is the inversion table, go ahead and do it for a little bit, right? I'd say, 60 degrees, 5-10 minutes. Don't go all the way upside down. Find an angle where it's just giving you that gentle stretch. But if you're doing it on a daily basis, 1, you got a problem. Something's wrong, right? So fix that. And then 2, I think it's too much straightening and stretching of your spine to be doing it every day.
And why not completely?
Well, I guess for those reasons I just said, right? 1, you're
going to the max on the damage.
You're going to the max. Your spine is designed to have 3 natural curves to it. So you're straightening out those curves. You're putting a lot of tensile stretch on those tissues that they're not designed to be stretched out. They're designed more to be compressed in that way. And I've seen people with normal spinal curves come out from spinal decompression with straightened spine. So I've seen it undo a healthy spine.
Ouch.
Okay. Does that mean it's going to happen all the time? No, but just don't overdo it.
Yeah.
And if you're doing it, chances are, it's like people are like, oh yeah, I crack my back all the time. It's like, well, why are you cracking your back all the time? Because joints are supposed to move without popping or cracking.
Right.
If you're cracking your back all the time, something's getting stuck. Okay. And if something is stuck, now those joints above it and below it are going to be moving extra. And they're going to get irritated. They're going to build up pressure. Cracking it will release the pressure from the joint. Okay. So that's good. You release pressure from the joint. But did you get the one that was really stuck, or did you get the one above and below it? And if you're constantly having to crack it, even if you are getting the one that's stuck, why do you have to constantly keep on cracking it? You know, what I'm looking for in my patients when I treat them is for areas not to adjust. It's like, all right, your spine is moving. Or when spine is moving really well, I can push into it and nothing will pop or crack. And they're like, doc, it didn't move. I'm like, no, your spine's moving. It's doing what it's supposed to do. You push on it, every joint moves, it absorbs the impact and it bounces back, right? The pop and the crack means something is built up pressure in there and something's restricted, right? So a healthy, you know, if somebody comes in and if I don't feel anything, that's what I want, is I want to feel everything moving well. I don't want to feel anything inflamed, muscle spasms. I want to feel it moving properly, bones, nothing sticking out in any weird way. And then when we push on it, that nothing is popping and cracking. It's just got that nice gentle flex and flow. So
I love that.
So anyway, so if you are constantly doing it for like some reason of relief, there's an underlying problem in there that you're not getting at.
There is. Doc, I got to tell you something about Sergio. So Sergio is the type of guy where if you get into a debate with him, he will play the long game with you. Okay. So if I'm like, Sergio, like, you got to try this coffee, it's the best. And if he says, no, it's not the best, and I hit him with an argument, he'll be like, okay, silently, like, okay. And he won't conclude to anything, and he'll play the long game, and he'll wait for the perfect time
to
pull the hammer and just smash you on the head. So I'm starting to think that this whole episode...
You guys started this whole podcast because 2 years ago you had an argument.
We had an argument
2 months ago.
He's like, bro, go to the car. I'm like, you should try my inversion table. It's better. And I talk a lot. I'm intense. So I guess he doesn't want to fight me head on. So he goes, okay, you like your inversion table?
No, but see, understand this. Look, it's like the parent, right? I'm going to tell you, you're not going to listen to me. I bring the professional, he's going to tell you why. And now you're like, okay, maybe I shouldn't go all the way down in my inversion table.
So yeah, we're all part of it. He's a very big planner. We got to be careful with him. Everything's part of his scheme.
Just smarter people telling you,
that I'm stupider. I mean, that I'm...
All right. So, Dr. Tony, how can they find you? Where can they go to find you? And I mean, what are you, and your ideal person that you would want to walk into your doors?
Anybody that's interested in better health, right? And their families, because our postural problems we got from our parents and we're giving to our kids. So look at yourself and look at your health problems, and then look at your parents, and you'll probably see you got it from them, and then realize you're giving it to your kids. So do you want to stop giving it to your kids, right? Do you want them to get checked? Do you want to get checked? Do you want your parents to get checked, right? So those are ideal patients. People that are sick and tired of the medical paradigm, that are sick and tired of medications being thrown at them, that are on a slew of medications that they're supposed to be on for the rest of their life. We have a trash can in the office that we call the trash can of limiting beliefs. That's where when patients end up correcting their spine and their nervous system turns back on, they end up seeing their doctors, and their doctors start cutting their prescriptions because they're finding they're functioning okay without them. So we don't take people off medications. That's not within my scope of practice. But as people heal, they do. Their doctors do. And they come in and they're super excited because their thyroid meds are down. They're off their blood pressure medication, digestive issues, and they toss them in the trash can. So that's, those are ideal patients too. People that just want to get off their drugs, right? As far as finding us, we are in Orange County. Right? We're close to John Wayne Airport. So we're on the border of, we're technically in Newport Beach, Back Bay. We're on the border of Newport, Irvine, Santa Ana. We're kind of right in that John Wayne Airport area. So ET Chiropractic. We actually started my old business partner, Ed and Tony. So that's why it's ET Chiropractic. That's why it's ET. It's like Ed and Tony. And like, that sounds dumb, but but people, one of the things that happened was I would meet patients and then they would say, I used to go to the chiropractor. I'm like, where'd you go? Like, I don't remember.
Yes.
Right. So Ed and I were joking one day, and I think we were having a beer. It's like, why don't we call it ET Chiropractic? At least people will remember it.
Yeah, they will.
And actually, it's as kitschy as it is. People will be like, what does ET stand for? It's like, well, at least they remember it.
Yeah.
Right.
I'll remember forever. Ed and Tony.
Yeah, Ed and Tony. Yeah. So etchiropractic.com and
Instagram.
And Instagram.
ET Chiropractic.
If I had an Instagram account, I would tell you what it is, but I know the office. I know the office has an Instagram.
That's
account.
The one we want.
That's the one you want. Is the office one.
Yeah.
And I'm sure you follow us on Instagram.
Absolutely.
So you have a better idea of what my Instagram account is than I do.
ET Chiropractic.
ET Chiropractic.
That's funny.
And honestly, if you've watched the episode, then you have a little bit of idea about my essence and about what I believe in and how I practice. If you're trying to get somebody in to open up their mind to find a way to treat their health in a better way, again, what we discussed is the workshop that we do on Wednesday nights. We do that just to basically give people a different perspective of their health, right? Non-medical paradigm that they get all the time from commercials, from their medical doctors, from their parents that they've just been ingrained in. Just to literally look at your health in a different way. And from a very scientific point of view, but also from a very common sense point of way. Like, this doesn't have to be rocket science. It's very simple principles. Your body needs to function.
Yes.
Right. And so that's what we talk about on Wednesday night. And I can answer questions for people too, and they can check out the office, find out what we're about, see how our approach to health is, and see if we're right for them. We're not right for everybody, for sure. And we don't accept everybody as patients either. Right? One, you've got to be there for the right reason. And we're also not going to take on cases where I don't think I'm going to be the best doctor for you. Right? There's things out of my scope, and I don't want to treat you if I don't think I'm going to be the guy for you.
Very cool.
So,
and you have a wall with plaques.
Oh, our lifetime wellness wall.
Yeah.
Yeah, lifetime wellness wall. It's where we put people up on the wall that have corrected their spine, that literally all their health conditions have just vanished and disappeared, and they're living their best life.
Yeah.
Wow.
So we have them decorate a little plaque, and we're starting to put.
I'm a little biased. Mine's the best one.
Yeah.
You have one?
Yeah.
You actually?
Yeah. He's on the wall.
I'm on the
Respect,
wall,
bro.
brother.
Yeah.
Wow.
I love that thing. It's cool.
That's
It's
dope.
cool seeing it get bigger and bigger.
Yeah, I mean, and so I need to put more intention on it because we get excited for so many different reasons. Like, people will have the correction of the month where their spinal cords have changed. Like, yeah, that's amazing. They'll get rid of their meds. Like, yeah, that's amazing. The people are hitting kind of different goals that by the time they're ready for the lifetime wellness wall,
It's full.
It's not as full. It's just, man, yeah, we got to get you on the wall. So every now and then we'll have a staff being like, holy crap, we didn't put that person on the wall. We got to get them their plaque and get them on the wall.
That's cool. Yeah. That's cool. Well, I'm glad. Well, thank you for being here again, Dr. Tony. I really do appreciate it, and for everything you did for me and my family as well.
Well, you know what? You've been an absolute joy to have in the office always. So one of the things we try to do is create a culture of people that we like, that I'd like to spend my day with.
Yeah.
And have more of those people in there. It's been a lot of fun to actually be in practice, being able to treat people like you. So
thank you so much.
Thank you for coming in, and thank you guys for both inviting me. I look forward to getting you off your inversion.
Yes, without a doubt. Absolutely.
I didn't say it was you. You're the one.
Thank you so much, Doc.
All right.
Guys, thank you for watching, and we'll see you on the next episode.